the risk of having a chromosome problem increases as we get older. And the non-invasive tests look at 3 of the more common chromosome problems, but don't cover all of the chromosome problems. So a couple may decide, since they are at an older age, to do an amniocentesis that looks at all of the chromosomes. That's one of the more common indications. Probably the next most common thing is when there is a screening test that has been done that puts the person at a high risk. And lastly, if there's a anatomical problem that is detected on ultrasound, where it may be due to a genetic problem, and so you may choose to test for that particular condition. An amniocentesis involves inserting a needle through the mom's abdomen into the sac of water through the membrane, which is called the amnion, and into the amniotic fluid. And so fluid is withdrawn and then sent to the laboratory to determine the baby's genetics or the baby's karyotype. And all 46 chromosomes will be looked at. The doctor will begin by doing an ultrasound to locate the best location where the needle will be placed. The needle tends to be a long-looking needle, and that usually makes people worry. What's really important in terms of how they feel is the thickness of the needle, and the needle is actually very, very thin. So it's somewhat like getting your blood drawn. It is a pinch, but it's generally a fairly quick procedure. And is not as uncomfortable as many people think. The fluid is withdrawn and then the needle is removed. We often quote somewhere between a 1 in 300 and a 1 in 500 complication rate, and that can include things from leakage of some fluid. The water bag a needle is being inserted. It usually reseals immediately, but sometimes there may be a little bit of leakage. Even that usually happily often stops and reseals and is not a problem, but occasionally it continues and doesn't reseal, and that can be a problem. So the main concern is pregnancy loss or miscarriage following the amniocentesis. Amniocentesis actually these days can be sent for a variety of different things. The sort of traditional thing is to send it for chromosomes. There is a rapid test that can look at our special 3 chromosomes that we're getting to know well, 13, 18, and 21, and also X and Y chromosome. And that special rapid test is sometimes called a FISH test. Those can give you results sometimes as soon as 24 hours later. The second part to it is a full chromosome analysis, a full karyotype. And even if you had a FISH test, they would do the full chromosome analysis also to confirm.